It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, this is Tammy Patzer, and I'm really excited to introduce today's guest, Karen Burns-Allen. Karen is an experienced integrative clinician, educator, author, and biofield researcher. She is a nationally awarded thought leader in integrative health and teaches at the Phoenix Institute of Herbal Medicine and Acupuncture. Karen serves on the National Biofield and Integrative Pain Committees for the Integrative Health Policy Consortium. In 2013, Karen began to work with Mahendra Trivedi, originator of the Trivedi Effect, a potent form of biofield energy medicine. As a biofield researcher, Karen has worked with Mr. Trivedi to create and document real-world outcomes with biofield that have been published in peer-reviewed journals. Welcome, Karen.
Thank you, Tammy. It's wonderful to be here.
This is certainly an exciting time that we live in, and energy medicine, of course, is something that, for those of us who watch The Big Bang Theory, that's probably all that we understand of energy or quantum physics or anything like that, because that's been around for about 10 years, and so we have that little bit of education. So can you start out by explaining what is energy medicine?
That's a great question, Tammy. And I do think that when people hear it, they think, I'm not quite sure what that is. So energy medicine addresses living systems like people, or I suppose you could use it for plants and animals too, but in general, it's a field of medicine that it's sometimes called vibrational medicine. In a living body, every molecule, every tissue, every organ vibrates. And energy medicine seeks to understand this vibrational frequency and to engage with it to facilitate healing. So this is a very modern form of medicine that is now emerging into the West, and we have a growing body of research that tells us what this stuff does. I have to also say that it's kind of controversial. There are a lot of people, like I came to energy medicine because other forms of medicine, drugs and surgery, were not working for me. And I needed to find a solution that could work for me. But I would not have reached outside the box had I not run into that wall. And energy medicine is a little bit controversial. Part of it is that we don't have tools. There's no MRI scanner or X-ray machine or thermometer for somebody's energy fields. We genuinely can't measure that yet. Although we know it's there, we can look at someone and we can say that person has a life force or they don't. If they're dead, then they don't. And we can also look at people and see, this person has very strong energy. They're very healthy and robust. Or this person has very weak energy. They're very weak. And so some of these we can observe, but for the most part, it is a subjective experience. It's something within the person. They can feel their energy. They can feel sensations and experiences of their symptoms, but we can't necessarily measure them. And one of the most obvious examples of this is pain. There's no objective measurement of pain, but every single person knows what it feels like. Anybody who's ever stubbed their toe or wrenched their back, they know exactly what's happening there. And according to energy medicine, the areas of the body that are feeling pain are experiencing some kind of blockage or constraint or deficiency in energy. And energy medicine seeks to resolve that.
I'm kind of chuckling to myself because the system they have for pain in hospitals, they have the frowny face and then they have the
Yes.
face, and you're supposed to point at your level of pain. And I think I have a high tolerance of pain because when I point at, let's say I point at the middle one, they kind of look at me like, are you sure? I was in labor, ready to, maybe 15 minutes away from delivery, and I walked into the hospital saying, I'm having a baby. My pains are 5 minutes apart. And they acted like I was crazy because I wasn't acting like I was in a lot of pain because I was tolerating it. So that's really interesting that when you say that there really aren't any ways to really measure pain. And just like the other night, I had a cramp in the top of my foot. And when you talk about blocked energy, it was kind of weird because I'd never had a pain in the top of my foot like that. And it was like nothing I did would make it go away. And I determined that I ate some grain, and I determined that I'm allergic to that because I did it 2 nights in a row just to see. Sure, I got the cramp again after eating a bowl of grape nuts. So now I know, don't eat grape nuts.
Oh, and this is interesting, Tammy. You talked about this one spot. You didn't get it on your left elbow or in your right ear. You got the cramp on the top of your foot, and you got it 2 times in a row after this same stimulus.
Right.
So one of the things that in energy medicine that we pay attention to are tracks through the body, energy tracks that in Chinese medicine, they're called meridians. And they have different points on them where energy clusters or it gets blocked or it flows through. And a lot of times those places where you eat something that you have a bad reaction to or you have some other stress and all of a sudden this one spot says, ouch. A lot of those are points on those energy tracks. So your experience is a perfect example of where we would be looking at energy medicine as it is showing us what it's doing in the body.
Yeah, and it's interesting because I was aware enough to say, this has never happened. What did I do that was totally different? Because I haven't had a bowl of grape nuts since I was probably a teenager. So it's, a long time. And I eat it because it was like, that memory of grape nuts went from, good, but boy, did I pay for it. And then it was like, well, maybe it wasn't that. I'll try it. Now I'm 99.9% sure that was what it was. So energy medicine as a science, is this something that has been built on traditions of, you mentioned acupuncture or Chinese medicine, they've been talking about the different meridians for thousands of years. So is this energy medicine? I have, I think, 2 questions. Would it be considered part of what they're calling functional medicine today when I meet functional medicine doctors, or am I misinterpreting that? And then is it built on these other like Chinese medicine or Indian medicine or Eastern medicine, I guess, versus what we consider Western medicine, where you take a pill?
Okay, that's a great question. A couple of great questions. Let's start with is it built on past traditions? The way that we understand energy medicine absolutely is built on past traditions. In fact, it goes all the way back to the Greeks. If you remember doing algebra when you were in school and Pythagoras and geometry and the Pythagorean theorem, Pythagoras was a mathematician and also a scientist of that time. And he wrote about vital energy that was perceived as a luminous body that could produce cures. And so from that time, we've had ways of talking about something that is energetic and not physical, but impacts what is physical. So in China, this is called qi, and that's what we use in acupuncture. In India, it's called prana, and that's what we're working with when we're using Ayurvedic medicine. In Japan, it's called ki. In Hawaii and in Polynesian medicine, it's called mana. So all of these different traditions around the world have some way of referencing the way that energy works in a body. And there's actually two sides of this equation. There's the energy that's like the superset, the big amount of energy, and then there's what's in the body. So it's sort of like there's the ocean and there's the fish. And the fish lives within the support of the ocean. All of us energetically live within the support of a larger energetic system. So you also mentioned functional medicine. And functional medicine incorporates a lot of different disciplines to try to look at what is it that will help heal someone. And if you go to a conventional medical doctor, they tend to be very disease focused. They are looking at what's wrong and how do I stop the uncomfortable symptoms of what's wrong. In functional medicine, they're much more likely to also look at what's right and how do I do more of what's right. How do we support and foster the energy of this person so that the body can self-regulate itself, so that the body can heal itself. So they're much more likely to look at things like diet and nutrition and exercise and sleep and all of the functional parts of someone's life to help relieve their symptoms. One of the other things that you mentioned about your foot earlier, one of the other things that's interesting about functional medicine or interesting about energy medicine practitioners is that a lot of times the spot where the problem appears, where the symptom appears, is not necessarily where the problem exists. So you or some of your listeners may have had the experience of maybe having back pain or, a wrenched shoulder or bad nausea, and having gone to an acupuncturist, and the person with back pain or a wrenched shoulder, you go into the acupuncturist and you think they're going to put needles in your back or in your shoulder. But you lie down on the table and they put them in your left leg and your hand. And you think, wait a minute, the pain is in my back. What are you doing? And this is one of the fundamental things within functional medicine, within traditional Chinese medicine, with all the different forms of energy medicine, is that we're dealing with a living system. And where the symptoms show up aren't exactly necessarily where they start. So, for example, if you have a blockage in an energy flow, it may show up in your foot. Or it may show up in your back, but to resolve it, you have to resolve the blockage where it exists. And in energy medicine, we find those things by evaluating what's going on with the meridians. And this is what acupuncturists are testing for. This is what Ayurveda practitioners who are helping people with yoga are testing for, or Qigong practitioners, or some of your listeners may have heard of Reiki. Reiki is another form of therapeutic touch or healing touch that's a type of energy medicine where people perceive the energetic vibrational patterns that are happening in the different organs of the body. Same thing happens with Qigong. And we talked earlier about the subset and the superset, the individual person and the larger energetic field. with some types of energy medicine, there's actually a transmission that someone facilitates, an energy medicine practitioner, from the larger pool of energy that is drawn from to give to a person who is deficient. So sometimes it's not a blockage. Sometimes, somebody's batteries are low and the practitioner is bringing in energy to top up their batteries and connect them with their own life force energy.
Wow, that's really interesting, because as you were talking, I was thinking about, for example, Reiki, and how I go to a little church, and they do every Wednesday. They actually do energy healing, and it's Reiki. That they're
Really
doing, and there's maybe 5 or 6 Reiki masters who come in, and they stand there, and of course they're the conduits for the Reiki energy, and it's quite a popular thing that happens at the church I go to. They're booked like solid from like 5 o'clock until 7 o'clock every Wednesday, where people are coming in, and no matter how many Reiki masters are available, they're all busy for this time. So I am familiar with that, and then I actually am familiar with acupuncture and qigong. I've experienced it, and you're right. Where they put the needles, you're going. You're sitting going, gee, that's an awful. But then when you're all done, you're like, feel good. It's like, oh, something did get released, or that energy is flowing. So you mentioned, and I'm glad that you mentioned those different types of energy medicine, because many people are familiar with energy medicine. They just don't realize that.
Yes, they don't call it that.
And then I have friends who talk about, like quantum physics and energy. Energy is everything, and that. So you talked a lot about that. So what type of person can benefit from all of this? And why do you think somebody should consider this in terms of, there's a lot of people, you go to your medical doctor, and like you said, they're trying to cure a disease instead of looking at, like you said, diet, exercise, all of these different things. And that's the sad thing about most of us, and I'm guilty, is that we don't do all of those things that we should, like eat right, exercise, get enough rest. All of the things are preventative. And so all of a sudden, like me, like I said, I was smart enough to recognize, there was a correlation between eating grape nuts, which is wheat, and milk. So it's some combination of wheat and milk. And to go, I got a foot cramp, not one night, but 2 nights in a row after not having any foot cramps. So that was something. So who and why should somebody consider this?
So you brought up the idea of the Reiki masters that are at your local church. And so there's a couple of different ways that I want to answer the question about who and why. We have a system of medicine, the conventional medical system, which is actually in large part a disease management system. People go to their doctor when they are in the category of fix what's broke. I have something that's broken and I need to fix it. Usually it's when something's in pain, something's not working well. And so they're going to their doc to ask for support with that one thing. That's one aspect of healthcare, but there's a huge amount of healthcare that happens outside the conventional medical system. And most of what happens in the conventional medical system is about, here I've got a problem, I'm going to be prescribed a drug, or here I've got a problem, I'm going to be prescribed maybe physical therapy or surgery. And so a lot of times that's what we're talking about within the conventional world. But our options, the menu that we can choose from, and the things that we can be engaged with cover all the bandwidth that the functional medicine world covers, which is everything we can do for ourselves with diet and nutrition, and also these other things that we can explore on our own, like Reiki, where you're able to go. And there are so many of these things that are done at local yoga centers and spas and health centers and community centers. An example is Tai Chi and Qigong. And actually, the country of Singapore has been a very big supporter of Qigong, and they actually have a group there that in 2010, their health promotion board, which promotes health and it offers disease prevention programs. In 2010, they started an outreach program offering Qigong classes and sessions to everyone in the public all around the country. And they were doing this as a way of preventing future disease and of elongating life and improving quality of life. And so they were especially reaching out to vulnerable populations, to young children, to people who were recovering from illness, to elders, in order to increase their health and quality of life. So when we look at who uses this, there's going to be a group of people who are open. They're interested in innovation. They're curious about what is beyond fix what's broke. When I work with my clients, a lot of times I talk about 3 different categories of intervention. The first one is fix what's broke. There's something like your foot that was in spasm, and we want to help with that. Another one is reestablishing self-regulatory mechanisms like circadian rhythms, things where you fall asleep in the evening and you wake up in the morning. And if you're falling asleep in the morning and not able to sleep at night, then you need some biorhythms repaired. A lot of those kinds of things aren't effectively dealt with by drugs and surgery. And so people who are working on reestablishing biorhythms a lot of times are reaching out into the functional medicine world, or the naturopathic world, or the Chinese medicine world, or the homeopathy world, or yoga and Ayurveda, or Reiki, any kind of energy medicine, because they want to support their body's ability to self-regulate. The third group, the third category of intervention that I talk with my clients about are people who are trying to build capacity. Maybe this is someone who went through a serious illness, someone who had chronic fatigue, and or they had some kind of a irritable bowel or something, a bad flu. They had something that really knocked them down. And they've gotten through it, and now they're trying to get back to their best level of health. And so they're really carefully paying attention to their sleep and to their diet and what they're doing. And energy medicine, whether it's something you're doing for yourself, where you're practicing Tai Chi, or whether you're seeing a practitioner like a Qigong practitioner or an acupuncturist or a homeopath or another kind of practitioner that I refer to, and something that I do myself is Trivedi work. I was introduced to a incredible leader in the biofield energy work space. His name is Mahendra Trivedi, And he is a real leader in the science on biofield and has done over 4,000 science research experiments showing the real world outcomes of this transmitted energy. And so I refer to him, or other people refer to me, or to other people who are doing that kind of transmitted energy work because they're trying to fill up empty batteries or develop capacity, or perhaps it's somebody who's under a particular strain, someone who's in graduate school, and they are just working as hard as they possibly can. I have an office in San Francisco, and a lot of the clients that I saw when I first moved there were people who were involved in Silicon Valley startups. And those people, they could work any 80 hours of the week they want. It didn't matter whether you came in at 10 in the morning or 5 in the morning or 4 in the afternoon, but you were still going to work 80 hours that week. And so there were people in the office 24 hours a day working on something. And there's a biological burden where your batteries get worn down. And you can get into a place where you get sick easily, your immune system is compromised, or you can't think clearly. All of those things are ones where energy medicine can help with building capacity.
So that's really interesting about just all the different ways that the energy medicine is being recognized more and more in the everyday of things. If you look back over the last 20 years, 25 years, you can really see medicine and people's awareness of all these things. And I loved your example of the was it Singapore that opening it up because they realize that it's going to help children, older people, just everybody that doing this type of work is good for everyone. So how would somebody, if they wanted to find a practitioner of energy medicine, what would you suggest they do to find somebody who is on top of it, I guess is a really good way to, because I would want to work with somebody who's really cutting edge in this field if I were looking for someone.
Mm-hmm. I think that for a lot of people, before they can even look for someone, they have to be willing to step outside the box. And so I want to go back to one of the first things that we talked about, which had to do with the idea that it's controversial.
Okay.
We live in a society where kind of the unspoken agreement between someone who's ill or wanting to be better and someone they're going to for help, there's this unspoken contract that this involves a pill. And this is why the placebo effect is so incredibly powerful, because we have this idea that we take a pill or we take an herb or there's a thing, or we do an exercise. We go to physical therapy and we do our exercises. So in each of those cases, there's a physicality to the interaction between the practitioner and the person who's getting help. They take their pill, or they do their exercise, or they drink their herbs, or they rub this ointment on their skin. So there's a physical thing that you can see. And for many people, they are not ready to step beyond the physical thing that they can see into energy medicine until they have a specific need. And there are two groups generally that I see having that specific need. One of them is innovators, early adopters. These are people who want the cutting edge of the next generation of a superior innovation. And that is what the emerging science of energy medicine shows. So those people who are wanting the innovation, they're going to be reaching out for people who have scientific validation of their capacity to heal. And certainly this would be true in Qigong, in Trivedi Effect medicine, in acupuncture, in things that are well documented in the science literature. And there are directories of Qigong practitioners, directories of acupuncturists. In the future, I expect the Trivedi Effect is one of the new kids on the block with regard to this. And I think that there will be directories of this kind of medicine as well in the future. And then there are some people where they're not innovators, they're not early adopters, but they are desperate. They have a problem. They have a serious problem. Like an example would be someone who had mono and their energy never came back. Or after the birth of their baby, they got really tired and their energy never came back. And they haven't found a solution in the conventional medical world. And so those people tend to try the conventional medical therapeutics. They go to their doctor, and then they go to a functional medicine doc, and then they go to an acupuncturist, and sometimes they still don't have a resolution. And for those folks, turning to things like Reiki, like healing touch, like laying on of hands, like Trivedi Effect, because they need deep work that helps realign their energy within this larger pool of life force energy. Those folks are going to be reaching out to directories with those kinds of practitioners. And, if anybody's interested in contacting me or in finding out more information about some of these directories, my website is www.lifeforcecatalyst.com. And you can find blog posts out there that give you information for how to go out and look in some of these different communities. So, those who are listening to this where you think, yeah, that's really not for me. I want something tangible that I can see. This may not be the right time for you, but tuck this idea away in the back of your mind. There may be a time when it is the right thing for you. And when it is, the memory of this conversation will come forward to you, and you'll say, oh, golly, energy medicine. I'm not stuck without options. I'm not stranded here. There are choices available to me. And then it'll be time to reach out and find someone.
Wow, that's really a good reminder about that, because sometimes we hear things and at that moment in time, it means like nothing really to us. And then, like you said, something will happen and all of a sudden it'll come pouring back. Oh yeah, I heard Karen Burns Allen talking about energy medicine, and maybe I should check into that because it could be an answer to whatever an issue is. Because that I think is the most interesting thing about all of this, is because even with regular medicine, you take a pill and you take it because you're told it's going to help fix this problem, but you don't know, you're just trusting. And
Right.
with energy, there's that trust. And I found that the more that I trust, the more good things happen, in general, in life. So it's lifeforcecatalyst.com. And that is Karen Burns Allen. And of course, go to her website and you can get all kinds of information about the energy and about what Karen is up to. And again, Karen does go to many conferences and she sits on many boards and she works with a lot of different committees. So she really does have a huge background in biofield research. So I think that you've definitely given us a lot of food for thought today. And I learned a lot about biofield energy and even about the pain in my foot. When you said it might not really be about the pain at the top of your foot, it might be something else somewhere else. Like obviously, if I'm allergic to grain, then it was like my system saying I don't like this, and it's sending this message down to my foot. It's like we got to tell Tammy about this. What will she notice?
Yes. And I love your example of that, because this so often happens. A lot of times people think, oh, I ate it, it went into my stomach. The problem should be in my stomach. But we are really interesting, dynamic beings. And our body is so interconnected that it can show up in all kinds of different places, like a cramp in your foot.
Right. Well, like I said, it was almost like, well, because let's say if I had a stomach ache, I would just go, whatever, the stomach ache. But a cramp in your foot, and then you're going, that's unusual because I don't get cramps in my foot. So then you actually pay attention to it, because it's not anything that you would normally experience. And it is very interesting how our bodies, do connect. And like you said, pain is probably one of the things that most humans, we pay attention to pain. We pay attention when we have a little bit of pain. Well, thanks a lot, Karen. I learned a lot, and I'll invite you back another time. But before I let you go, is there any last thing you'd like to say?
I just want to encourage everyone to drink in the energy that's around them. Take a minute to breathe deep, to connect with yourself, with the energy inside your body, no matter what kind of medicine you're using, whether you're using conventional drugs or whether you're working with diet and nutrition and exercise, or whether you're working with energy medicine and Reiki or Trivedi Effect practitioners. No matter what it is, the most important part for you is your experience inside you. So take some time today after you listen to this, or sometime over the next week or two when it comes back to your mind, to breathe in and connect with the energy inside you. Breathe out and connect with the energy outside of you. This is feeding every part of your life all the time. And as you become aware of it, you're going to be more able to get benefit from any kind of medicine.
Well, on that note, everyone, this is Tammy Patzer. Go make it a beautiful day. Thank you, Karen.
Thanks, Tammy. Bye-bye.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.